1 2 1 2. All right, I'll just stand right here. This mic will pick you up, so we're good.
Oh, okay.
Yep. If you would just tell me your first and last name for me.
Bob Howd,
Will you spell that?
Hendersonville, Houde.
Excellent, excellent. And so I guess we'll just start easy. Tell me why you guys are out here today.
Well, we understood that Mr. Collins was going to be here, so we wanted to show him how we feel about the VA, obviously, based on what the Trump administration is now doing to degrade the entire VA system. So it's pretty easy for us. I don't personally use the VA. I'm not enrolled in the VA, but many of my friends are, veterans out of Hendersonville, out of Asheville. And in general, I don't quite understand how they think they can simply walk away from all the years of service of the folks who have to use the VA. And I've got at least 5 or 6 friends that come here on a regular basis because of things that happened to them back during NOM.
And maybe just the importance of you guys coming out here on the day that he's here.
Yeah, so it's show and tell. It's like, hey guys, there are plenty of us here. There are plenty of us that are going to voice an opinion relative to what's happening in the Trump administration. We don't like it. We don't want it. And we're here and going to stand firm.
Awesome. I'm good if you're good, sir.
Thank you. Thank you.
I appreciate it.
Yeah.
You know, brother engineer. No.
Bruce Carruthers, nice to meet you.
So Bruce is a member of the local chapter of VFD.
Okay, perfect.
And he is also on the task force, or like the task force fighting to save our VA that Veterans for Peace has as a national project.
Yeah.
And he used to work for the VA.
Oh, wow.
And he's a patient of the VA.
Yeah.
So there's his qualifications.
Yeah.
Instead of me. Thank you, Cody.
Absolutely. Thank you, sir. How you doing?
I'm good.
Good. I'm Cody.
Cody, nice to meet
Yes, sir.
you.
Likewise. So let me get you framed up here, and then I'm going to stand to the side and we'll just talk.
All right.
So you want to stand just kind of about where you were? Stand right here and you just talk to me, and will you go ahead and say and spell your first and last name for me?
Yeah, first name is Bruce, B-R-U-C-E. Last name is Carruthers, C-A-R-R-U-T-H-E-R-S.
And your affiliation with all of this?
Well, I'm a member of the local chapter of Veterans for Peace. I'm on the steering committee of the Veterans for Peace Save Our VA National Campaign, and I'm the president of an organization, the Veterans Healthcare Policy Institute. So I've been involved in these issues with veterans pretty steadily for at least 5 years. I'm also a Vietnam veteran, and I'm a retired VA employee. I worked in 10 different facilities in the VA all across the country, including 3 years in central office in Washington, D.C. So I'm really familiar with how the VA functions and really concerned about what's going on. You know, there are a lot of things going on besides these potential employment cuts. The VA has cut back on a lot of VA research contracts. People don't realize what the VA does for the U.S. healthcare system. So, for example, 70% of all physicians receive some of the training at VA facilities. VA research has been responsible for the shingles vaccine, for the pacemakers, for all sorts of prosthetic devices for wounded veterans that help the public. It is the second largest research program, only to the National Institutes of Health. The VA provides a holistic approach to health, so I get my health care here. I don't have to go anywhere else. There's a team, so if I see my primary care provider and I have any other kind of issue, he refers me directly to somebody else. Unlike the fragmented U.S. healthcare system that we currently face. And there's no profit in the VA, so there's no incentive to order unnecessary tests, to order medications that aren't necessary. There was a study, I think, by the GAO treatment for prostate cancer for veterans in the private sector, and it found that rather than a standard of practice for low level, which is active surveillance, they were ordering unnecessary tests and unnecessary procedures because there's a profit incentive in the private sector. So one of the things I think that Secretary Collins ignored when he talks about these cuts, he says we'll go back to the 2019 level where everything was fine. Since then, the PACT Act was passed, which provides benefits for toxic exposure for post 9/11 veterans and other veterans who are exposed to that. Since that was passed, over 400,000 veterans have enrolled in VA health care, and over 1 million claims for service connection have been processed. That's why the additional staff was added by the Biden administration to handle the impact of the PACT Act. What's really going to happen to, especially younger veterans, if the VA disappears, nobody's going to track what happens to people that have traumatic brain injuries, toxic exposure, military sexual trauma, because only the VA tracks that kind of stuff. So I have service connection from exposure to Agent Orange, and I only have that because the VA has an Agent Orange registry and has done research on it. If I saw a private provider, he or she wouldn't know to ask me, well, I serviced in Vietnam, was I exposed to anything? So the VA is essential not just to veterans, but to the health care in general. The Association of Medical Colleges stated to Congress clearly that if the VA disappears, it'll have a real problem training physicians. The VA has affiliations with almost every medical school in the country and over 1,000 affiliations with other institutions that treat healthcare professionals. It's an integral part of that, and its last mission is national preparedness. It provides a backup to the civilian healthcare system in case of emergency. And during the COVID pandemic, it provided a lot of help to private hospitals, including sending VA staff there to assist with health with patients. And I don't know, anything else you want me to say?
Oh yeah, I was just going to ask you too about the you guys coming out here today with him being here. I mean, what's the ultimate hope for you guys?
Well, the ultimate hope is that he'll understand that these cuts are really hurting veterans and reconsider it. When he was confirmed, he said he wouldn't do anything to hurt veterans, but these cuts are going to hurt veterans. They're going to slow health care. They're going to slow processing claims from veterans for pensions, for disability compensation. If he cuts the memorial services, it'll slow burials for veterans. So it will really hurt veterans. You know, if we don't want to take care of veterans, then we shouldn't be getting involved in so many of these wars. We have over 600 military bases all around the world. So if we want to have that kind of military, you can't have people come into the military then not take care of them afterwards. I mean, it should be part of the defense budget. It's part of having such a large military complex. So I'm hoping that he gets the message. There have been demonstrations all over the country about this. This is just one. And I'm hoping he gets a message and reconsiders these cuts.
Is there anything else you wanted to say about it?
Well, no, just that I hope people realize that the promise that America made to those who answer the call to duty is to take care of them afterwards, and that they write to their senators and their congressmen and say, you know, this is unconscionable. And it's not just cuts to the VA. I mean, cuts to Social Security, cuts to Medicaid. These are programs that help everyday Americans, and it's not right to try to balance the budget on the back of veterans or the back of everyday Americans. There are other things that can be done. For example, a fair tax system, reducing waste in the Pentagon, which has never passed an audit. We spent, I think, $2 trillion on the F-35. It's still not fully operational. So there are a lot of ways and cuts can be made, and if any cuts are going to be made to an agency, they need to be made in a reasonable process that's actually studied, not with a meat axe, which is what they're doing to the VA. I mean, the VA, about a third of the VA's workforce are veterans, and a lot of those people have already been let go. And you know, and you guys think about this, some people were let go with 15 minutes notice. Not 2 weeks, but 15 minutes. And Americans could ask themselves, is that how we treat each other? Is that how I would like to be treated? Well, I've got a home, I have a mortgage, I have kids in school. Do I want to just get an email that says you're fired, you got 15 minutes to clear your desk out? That's not how Americans should treat each other. I think that's it. All right, thanks for interviewing me. I appreciate it.
Thank you, sir. I appreciate it.
You think we'll be on?
Yep. This was live streaming right now, and then I'll
this is live stream now.
It is live stream.
Oh,
Sorry to
well, thanks
interrupt.
for the chance